Welcome to Health Policy, Organization, and Finance. This is your Week 6 video. Week 6 is about long-term care. A lot of students have trouble with the definition of long-term care, and that's because the definition of long-term care can be different from source to source. Long-term care is about services that allow people to live as independently as possible. A lot of long-term care is actually not medical care. I find it's helpful to think of long-term care as any care that doesn't have a finite end. So care that you know needs to be ongoing for the time being. A lot of long-term care focuses on activities of daily living, so ADLs. This includes bathing, dressing, toileting, transferring, incontinence care, and eating. You also hear in long-term care people talk about IADLs. These are other services that might help someone be independent under the long-term care umbrella. Some examples might be managing your checkbook, managing medications, meal preparation, or food, clothing, shopping, anything like that. So things that aren't necessarily getting up and out of bed and doing things for the day, but more those things that have to be done periodically to be independent. So who provides long-term care? This is another hard concept. You know, in acute care, we often think of the healthcare team as including doctors and nurses, social workers. Long-term care can really often be a whole range of folks that aren't necessarily a nurse, like an RN or a CNA or an LPN. Long-term care can be provided by a family member or a friend. They can be provided by an adult daycare, which looks a lot like a school program. Can be provided by a long-term care facility. The most often professional working in long-term care, though, are personal care assistants. Now, these are folks that are usually not a CNA, have done a training course through a college or maybe not through a college. Sometimes they can be trained by their own facility that they're going to work at, but these are called different terms in different states. But these are folks that really help with those ADLs and those IADLs. Those professionals are the ones that do long-term care predominantly throughout the country. How much does long-term care cost? Well, these are some averages, and I have to tell you from personal experience, these can swing pretty wildly from these costs right here. So the federal government says that the average for a semi-private room in a nursing home is $225 a day, or about $6,800. What they mean by semi-private room is a room that you're sharing with another person. $253 a day, or $7,600 for a private room in a nursing home. I think because these are average, you can imagine that some nursing homes will be $5,000 a month and some will be $10,000 a month. But as you can see, nursing home care is quite expensive. $119 a day or $3,000 a month for care and assisted living facility. What's the difference between a nursing home and an assisted living facility? Well, an assisted living facility is usually something like a nursing home, but with less care provided. $20.50 an hour for a health aide, and that includes a home health aide. So to have someone come into your home for about 5 hours a day would probably be well over $100. $20 an hour for homemaker services. Homemaker services usually are folks that have less kind of health training. So folks that might do IADLs instead of ADLs. Rather than helping you use the bathroom, these are folks that will lay out your medications and help prepare meals and clean up around the house. $68 a day for services in an adult daycare center. So those can also swing wildly. That would be for taking someone basically during work hours and dropping them off so that they can do somewhat of a school program, not unlike daycare for children. Often utilized by families with someone who has dementia, that they're uncomfortable leaving home or being alone for the day. Adult daycare services provide kind of a structured day-long program for people outside their home. Who pays for long-term care? So we'll go back to some of our topics from the first couple weeks. Medicare. Most Americans think that Medicare pays for long-term care. Medicare does not pay for long-term care. It only pays for skilled care. What makes this confusing is skilled care is sometimes provided in a nursing home. So a lot of times people will go to a nursing home to receive rehabilitation. Medicare pays for it, and they think, oh, Medicare does pay for a nursing home. Not really. It pays for a service that can be provided in a nursing home. Medicare will only pay a maximum of 100 days. However, the average stay is much smaller than that. It's about 20 days. It's very rare to see someone actually use all 100 days of their Medicare for rehabilitation. You would often see it in cases where someone can consistently progress in their rehabilitation for up to 100 days, which is almost 4 months. So maybe somebody who is younger and had a significant brain injury would be a good example of someone who could really max out those 100 days. Often not the case. You can also use Medicare at home to receive skilled care at home. But basically, Medicare is not going to pay for those ADLs or activities of daily living, which make up long-term care services. So Medicaid. Yes, Medicaid will pay for long-term care services. But usually there's a two-part requirement. Now, because it's based on Medicaid, right, we know that it might be different from state to state since they're all different. In each state, there's usually going to be a two-part requirement to get long-term care to be paid for by Medicaid. One part of that requirement is your income and assets will have to be below a certain level. Now, usually this is going to be different from their regular Medicaid program. So a lot of times there's two types of Medicaid in each state. There's that Medicaid that people get access to that pays for going to the hospital and going to their doctor, getting surgery. Then there's this other type of Medicaid called long-term Medicaid that has a separate set of requirements. So if you need long-term care in a state and you're going to be able to access Medicaid, you have to meet that income test. But there's probably also a medical assessment that is required. Basically, an assessment done by probably a nurse or a doctor that says this person needs this many ADLs or IADLs through the week. Therefore, they should have Medicaid pay for long-term care services. So Medicaid is the main payer in this country of long-term care, but you have to get over some hurdles to access it. There are some other federal funding sources for long-term care, such as the Older Americans Act and Department of Veterans Affairs. If you're a disabled veteran, sometimes the Veterans Affairs Office will pay for long-term care rather than Medicaid. Since that's a much smaller population, I won't go into that deeply though. What about other insurances? Employer-sponsored plans usually do not pay for long-term care. And the reasoning is, why would they pay for long-term care? Because if you're working for them and you need long-term care, you probably are no longer going to be able to work for them. What they do pay for is that rehabilitation stuff, similar to Medicare. So employer-sponsored plans are more like Medicare in terms of long-term care than Medicaid. There are other sources that people often use. Long-term care insurance used to be very popular. You'll hear about that a little bit this week. Not really popular anymore. But really, that was the other major payer of long-term care in this country. Oftentimes now, people will utilize cash from other sources, like a reverse mortgage, a life insurance that they can cash out, annuities they can use. Most Americans will use those in cash to privately pay for long-term care. So let's quickly use our tools to look at long-term care. So cost. We know long-term care is really, really expensive. Nursing home bed, especially if you want a private room, could be about $10,000 a month. Quality, you're going to hear a little bit about that. Some people say that long-term care has really good quality. Some people say long-term care is really terrible quality. Access. Similar to some of our conversations in the Medicare week, I think it's important to consider whether the cost of long-term care impacts the access. Now, because it's covered mostly by Medicaid, we know that a lot of people can get access to long-term care. However, if you don't qualify for Medicaid, do you really have access to long-term care? So this week, you have a discussion post with an interesting scenario. You have a couple readings, including Chapter 12, and a couple of short videos as well. As always, let me know if you have any questions, comments, or concerns, and I hope you enjoy Week 6.